Introducing Siesta Medical's Encore tongue suspension system for obstructive sleep apnea. Normally, as a person sleeps, their palate and tongue base remain in a position that provides for an open airway. For most people with obstructive sleep apnea, the soft palate and tongue fall into the airway during sleep and block or narrow the airway. When this happens, normal breathing cannot happen. The Encore tongue suspension system is designed to suspend the tongue out of the airway during sleep so that these blockages do not happen. In the Encore procedure, a small incision is first made under the chin of the patient. The Encore suture passer is inserted through the incision and into the tongue muscle near the tongue base. Activating the suture passer creates a suture stitch at the desired location. The suture passer is then removed, leaving the suture loop in place. A suspension line designed to provide effective suspension of the tongue is now exchanged with the first suture loop. A small titanium bone anchor is used to anchor the suspension loop to the chin. One at a time, the ends of the suspension line are threaded into the bone anchor. Tension is placed on the suspension line to advance the tongue to prevent it from falling into the airway. The suspension line is then locked in the bone anchor and the advancement is maintained. If residual airway obstruction remains, a second loop can be placed, advanced, and locked to resolve this. The incision is then closed.